So welcome to the State of the Health of Chicago. We're celebrating our 8th convening with a series of virtual convenings that started in September. We culminated on October 23rd, which is a few weeks ago, with our kind of formal State of the Health of Chicago program. This is our post-election contribution to the program, and we'll be talking to Congresswoman Robin Kelly today. And later in the month, we'll be talking to Senator Dick Durbin. So thank you. Christina, next slide, please. As you know, the Institute of Medicine is an independent organization of distinguished leaders in the healthcare field who are collaborating to improve the health of the public. We draw on the expertise of a diverse membership coming from across various lines of professionals in the healthcare space. Next slide. I want to thank our Board of Governors, many who are on today. I want to thank you guys all for your support to this point. We've been very busy since I took office in June of this year, and we'll look forward to continuing to work together. Next slide. Today's panel will feature Congresswoman Robin Kelly. And as we said before, Congresswoman Kelly has dedicated her career to public service as an advocate for Illinois families. Since being elected to serve in 2013 for the 2nd Congressional District, she has worked to expand economic opportunity, community wellness, and public safety across the state. She's championed numerous initiatives to generate job growth, reduce health disparities, and end gun violence. Recently, she is known for her leadership with the U.S. House to help us pass the bipartisan Helping Moms Act that was introduced by her. The Moms Act is aimed at reducing and ending America's growing maternal morbidity and mortality crisis. She serves on several committees, including she's a member of the House Energy and Commerce Committee. She serves on the subcommittee, Health, Energy, and Consumer Protection and Commerce. She's a member of the House Committee on Oversight and Reform and serves on the National Security and Civil Rights and Civil Liberties subcommittees. And she represents the Midwest Region 4 on the House Democratic Steering and Policy Committee, which sets the policy direction of the Democratic Caucus, and she serves as a member of the House Democracy Partnership. She was formerly the Chief Administrative Officer at Cook County, and she was Chief of Staff to Illinois State Treasurer Alexi Janulius. She has a bachelor's degree in psychology, a master's of art in counseling, and a PhD in political science from Northern Illinois University. So we're introducing her in advance so that when she comes on at noon, because we only have 30 minutes with her, we'll get right down to our discussion. So we look forward to welcoming Congresswoman Kelly. Next slide. Coming up, we hope to confirm soon Senator Dick Durbin for December 4th to come talk with us about the next 4 years regarding Medicare, Medicaid, and innovation in the healthcare space. So we hope you'll continue us for these kind of nugget bite-sized touch points with our legislators. Our holiday event will be on December 10th, and we're looking forward to doing a virtual convening, and it'll be a 2020 year-end review, looking at the health equity gap, our progress to this point, successes and lessons learned take us into 2021. Next slide. I want to thank our sponsors. And Christina, you can just roll these forward. Blue Cross Blue Shield, Rosalind Franklin University of Medicine and Science, the Portis Foundation, the Michael Reese Research and Education Foundation, the Hectone Institute, the Washington Square Health Foundation, NextLevel Health, Care Advisors, Aunt Martha's Health and Wellness, and Golden Square. So please use the chat box to submit your questions so that when Congresswoman Kelly joins us, we'll be able to jump right in. We have about 5 minutes or so before she hops on. Are there any particular questions that folks who are on the call anybody want to speak or give ideas about what you want to hear, I'm happy to hear those. Got a couple questions here on violence prevention. What does she recommend for IOMC to do to address violence and help direct resources saved from this prevention to improve health and wellness? A question about what is happening with home lending equality. What is it at risk? Other questions I have for her ask about the social determinants of health, and are there any upcoming actions that Congress will take to address these? And this question reads, data shows that 80% of the path to good health is determined by factors that are not healthcare, access to jobs, issues with not being able to pay rent, losing your home because of mortgage payments that you can't make. How is Congress thinking about these issues in the upcoming session? Want to ask her a little bit about her rural constituents and any thoughts or upcoming legislation that will consider the health of rural residents. Want to talk about the MOMS Act, and then ask her also about any other insights on women's health. And then COVID-19, she'll have some remarks about COVID-19 and some of the actions that she sees the upcoming administration taking. Are there any other questions, or does anyone have anything they want to say before she hops on? See a question about stimulus bill, sort of before the new administration and then after. So we'll definitely ask her about that. So thanks everybody for holding patiently. When you're dealing with the legislators, you want to all be on and just be prepared as soon as they get here, so that we kind of don't use up any of their time. We want to use it all to really kind of dig into the conversation. So if you're on the chat, you can send it directly to everyone if you have a question, or send it directly to me if you like. So love to hear from you guys about any other questions that you want her to answer for you. You guys know that the ACA is coming up before the Supreme Court, I believe, next week. Has anybody heard what the temperature is there for striking down the ACA? Mm-hmm. Okay. So the ACA went in front of the court today. Anybody hearing about what the temperature is? And then apparently President-elect Biden is speaking on it today. Okay. Question about, assuming the Georgia Senate runoffs don't switch the power in the Senate, how can the House and President Biden work with Mitch McConnell to pass stimulus infrastructure improvement in the ACA? All right, guys, these are some great questions. So okay. So we're gonna, ask all of you for your input on how these convenings have been going, what you like about them, what you don't like. you should have received, you're going to receive, if you haven't already, a survey that asks um, for your feedback. We want to figure out what works, what makes sense. We're all trying to adjust to this new environment, but do feel like the Institute of Medicine should be a place where it really a premier convening platform for health professionals, really in the state, but certainly, in Chicagoland and in the county, in the collar counties. So we've had, a really sort of diverse set of panels. We talked about no wealth, no health. And so the importance of wealth, or at least the opportunity to accumulate, that would allow you to take care of your families and then allow you then to concentrate on your health care. So we are, that's why I want to talk to Robin Kelly today, to get ideas about where that actually is going to go, because national policy does kind of drive some of what goes on locally, and is very important. We did talk about maternal mortality and morbidity. So having her talk about the Moms Act will be important. That's connected to some of what we're doing. We're talking a lot about equity, and coming up in February, we've got a session scheduled to kind of continue that conversation on racial inequity. We're putting together a panel on an awesome late January. Mark Shields is helping to put this one together. Well, we'll bring in the chair of the Department the chair of the School of Public Health at University of Illinois, along with some other health experts to talk about, COVID-19 and issues in the outside of Chicago. So really going past the Chicago borders, now talk about our outlying areas where there's been extraordinary amount of disparity and issues that we're dealing with. It's also important to let you know that the Blue Cross has funded the Institute for $50,000. And a part of that funding, they're asking, they want to work with us on our implicit bias program that we're hoping to roll out towards the end of Q1. So we'll be using those dollars to support program development in that area. If you're interested in this, if you reach out to IOMC staff, our IOMCstaff.org email, and we'll be looking for speakers and putting together a curriculum, and also putting together continuing education credits for continuing medical ed, continuing nursing ed, and if there are other continuing eds that we need to kind of include, let us know that, because we want to try to be as inclusive as possible and react to our members' needs. If you could let me know when Congresswoman Kelly is on, I'd appreciate it. I expect her any moment now.
I'm on.
There you go.
I've been on. I've been listening to you.
Oh, wonderful.
I heard your whole speech.
Well, there you go. You know what the Institute of Medicine is doing. Well, welcome.
Busy.
And you are busy. And thank you for taking a few minutes to talk with us, Congresswoman Kelly. We actually have some great questions for you. I know you're prepared to answer them all. We've actually done your introduction. So you're all set there. We know who you are and have walked down your resume, and so excited to have you on today. Look, I know it's been a busy few weeks for you and all of your colleagues. How are you feeling?
I say relieved. I'm relieved. I'm happy. I'm ready to get some things done, when we go back to Congress next week.
Very good.
So I'm good.
You're good. Well, good. One of the questions that, I know you guys have been thinking about this, that if Mitch McConnell is still the Senate Majority Leader, how are you all thinking about working with him to have a Democratic House, a Republican Senate, and a Democratic White House? How are you all thinking about working with him to get things done? I know that's something that's been an issue before, but will we be able to get big projects done, Congresswoman Kelly?
Let me say this before well, thanks for having me. I just want your audience to know I work in a very bipartisan manner. I can give a lot of examples, but I'm hoping that because it is Joe Biden and he has such a history in the Senate and he has such deep relationships that things will be better. Leader McConnell has talked about getting finally a package together for whether it's some semblance of the HEROES Act that we have. And I know Amy Klobuchar, for instance, has already reached out to her Republican colleagues. And one of my colleagues in the House told me that a Republican colleague reached out to her. So I think maybe there is a new day, not completely like we wanted, but I'm hoping, because the American people, I don't care where you're from, or, you know, red, blue, whatever, you know, you need us to move America forward.
Indeed.
So I'm hoping, I'm an optimist.
And you are, and we appreciate that. And know that you work in a bipartisan fashion. So you're waiting for that opportunity, right, for us to get down to work. So Congresswoman Kelly, you have mostly healthcare professionals, people who work in the space, whether it be foundations, hospitals, practicing physicians, they run health centers, they may run patient advocacy organizations, or so let's talk a little about the social determinants of health. That's kind of how we think about this. So this next question is really kind of getting at those things. Data shows us that 80% of the path to good health is determined by factors that actually aren't actual healthcare. It's access to jobs, issues with not being able to pay your rent or mortgage, losing your home because of mortgage payments you can't afford. You know, and now we're in a global pandemic where some of these issues are going to take on just a heightened importance. Are there issues that you guys will take up in the upcoming Congress to address these? In our mind, we call them social determinants of health or financial health and wealth.
You know, it's interesting because I call them social determinants of health also, but I started calling them, frankly, the social determinants of life, because, you know, I do a lot of work around gun violence prevention, and it's some of the same things that people don't have opportunities or access to opportunities, and they don't have hope. So in the HEROES Act, first and foremost, some of the things we want to do is, well, first of all, have more money for testing and contact tracing and treatment, because we feel like we have to crush the virus before we can do, you know, a lot of things. But there, we want to do a lot of work around job skills and workforce. We want to do more work around healthcare. I was on soon to be President Biden's health task force. And one of the things that he's looking at is creating not a new profession, but more community health workers. So people right in the community will have jobs to help educate other people, their neighbors in their community, for education and awareness. So there's a lot of things we want to do. Frankly, there's a lot of things that are sitting on Mitch McConnell's desk that we'll have to refile, that, you know, deal with gun safety, deals with, you know, food, deals with, you know, voting rights, deals with workforce, deals with jobs, deals with infrastructure that will create jobs, actually deals with healthcare around infrastructure, which is something new, deals with more access to broadband. It's hard to have e-learning or get jobs if you can't even get online. So we have a lot of things that we're really ready to, you know, run when January 20th comes. That have really been in our pockets or whatever all the time. Like I passed legislation around maternal mortality that states are incentivized to expand the postpartum Medicaid period from 6 months to a year. It passed in the House. We're just waiting for it to pass in the Senate. So and it passed in a bipartisan way, you know, so we're just waiting. That's what I'm excited for the possibilities.
Congresswoman Kelly, you know, in terms of housing, that, you know, the South suburbs was one of the places that took a real hit with the crisis of, was it 2008 and 9, and are still recovering really from that. You know, are there any thoughts you have around, you know, loan for, you know, modification, forgiveness, some of the considerations to keep people in their home during this time?
Well, I can tell you, when I became a member of Congress 7.5 years ago, you remember it well, my district had the highest rate of foreclosures. So I hired someone in my office that is like a housing expert. And I can tell you, in my district alone, we've helped hundreds and hundreds and hundreds of people with loan remodification and other housing issues too. So we know that it has gotten better, but now we know, because of COVID, there can be issues. So again, in the HEROES Act, there are allocations and help for people that either can't pay their mortgage or people that can't pay their rent also. So hopefully we'll be able to get that passed. And as a matter of fact, Maxine Edwards, it's in the HEROES Act, but she pulled it out as a separate bill because we know how important it is. And the other part of it is we don't want to tell people you don't have to pay your rent or mortgage, and then the people they owe the money to, they don't get their money. So we're trying to make everybody whole. We don't want after 8 months of not paying your rent, then you have to pay thousands and thousands and thousands of your rent. You probably can't do that either. So we have legislation that deals with that. And I will give a special shout out to community banks because they really step forward in ways that sometimes the big boys and big girls did not step forward. It's particularly for smaller business and Black and brown businesses. They went to smaller banks. And in my area, which is urban, suburban, and rural, the rural and suburban banks, community banks, they're the ones that step forward. But they told me that they have a lot more clients now because they did that and helped, the smaller businesses.
So thank you. You often say that your district is urban, suburban, and rural. And, and one of our members is asking, Republican support actually comes from a lot of it comes from heavily rural areas. What is the opportunity for like a bipartisan approach or legislation that would appeal to both rural and urban populations around economic and health issues, Congresswoman Kelly, and maybe potentially unite us? I think we're all kind of sensitive to the fact that we feel sort of divided right now, and there's a lot of national rhetoric, but a lot of rural people are hurting too.
Oh, definitely.
And so any thoughts about, is there a difference that this new administration can make in making things better for these residents?
Well, he says he's not the Democratic president, that he's the American president. And, I believe that he will carry that out. And for me, I don't care if you voted for me or you didn't, or you didn't vote for me, you're my constituent. And I approach, my idea is everyone or most people want a roof over their head, a job, healthcare, good schools for their kid, and safety. And so that's how I approach it. I think we all have that in common no matter what. And I actually have 1,200 farms in my district. And I know when I was elected, the farmers were like, oh my God, who do we have? But what they didn't know, my grandparents and parents we had a little mom and pop grocery store in New York, but we had a little farm that we got vegetables to take to the little grocery store, but in New Jersey. And I have a very good relationship with my farmers. And I know most of them are Republican. They don't look like me, but I've gotten just recently 2 awards from them. And it means more to me than anything. And I do a barn hall meeting instead of a town hall meeting, every year. We couldn't do it this year because of COVID. And I know most of the people sitting in that room are Republican, but I listen to them and what their needs are. And their needs are a lot like urban needs. Like I said, people want healthcare. People want to make sure, like they're worried about, their businesses and trade and China, and those kind of things too. I actually have, legislation that I've worked with them on that they're not taxed as much for things they grow. And where in the agricultural committee, we have farm bills, but also we have bills that deal with SNAP, and those bills are together, so they take care of each other, and so we do. There are some committees that are more bipartisan than others, and agriculture is typically one of them. Agriculture and foreign affairs. There are bipartisan committees and that people work together. But I think with healthcare, people want healthcare at a reasonable rate, and they want the cost of prescription drugs to go down. I'm on oversight and reform, and I'm also on ENC, the healthcare subcommittee, and people are aligned, Democrats and Republicans. We always don't have the same path to get there, but people have the same goal at the end. And we do work together.
Great. You talked a little bit about the Moms Act. Can you tell us a little bit more about that and how you think this will close the death and disease gap for Black moms and babies? Illinois, unfortunately, kind of is a state that has a
Right.
really intractable almost problem in this space. And so talk a little bit about that work and what
Mhm.
you hope to see.
Sure. Actually, 3.5 years ago or something like that, I had no idea what a problem that this was. And we wound up having a seminar with Judge Hackett because of what happened with her daughter-in-law. But we put together first the Mamas Act. And the Mamas Act is a comprehensive piece of legislation, is multi-pronged to address maternal mortality. It deals with looking at best practices, like why do some states and some hospitals have a bad track record and others don't. We look at review committees. Philadelphia started a review committee and their maternal mortality went down 75%. We look at cultural competency, not my favorite word, but you said implicit bias. We look at that. And how do we get more healthcare professionals in the healthcare pipeline? We think that's very important. The other thing, which I mentioned that was a part of the Mamas Act, but we pulled it out and got it passed, was extending the postpartum period from 2 months to a year. You know, everyone doesn't lose their life or have an issue right when they have a baby, as you guys know better than me, or, you know, up to 2 months. Things happen. We've met many moms, or I heard many stories that moms got sick after that. So extending the Medicaid period. So that Mamas Act, we could not get passed, unfortunately, but we pulled out the Medicaid part, and that's the Helping Moms Act, and we did get that passed, but we got it passed in the House. We didn't get it passed in the Senate yet. So we're hoping in 2021 we can get it passed in the Senate. And like you said, with Black moms, 3 to 4 times the rate of white moms. In Illinois is 6 times the rate, but in the state of Washington, Native moms is 8 times the rate of white moms. And it's you know, we need to be listened to, and people need to realize we don't want any more pain than, you know, anybody else. So there's still so much work to be done, and it's shocking. And as a mom with 1 daughter and 2 stepdaughters, and 2 of the daughters haven't had kids yet, to think that it was safer for me to have my cesareans than it is for my daughters to have a baby now. It's scary.
So the IMC is taking this on as one of our initiatives this year. So we hope to work with you
Fantastic.
on that. Um,
Sure. I would love that.
you've done a lot of work on violence prevention, you know, Robin, over the years. Do you have any recommendations for the Institute of Medicine of Chicago that we should do to address violence and help redirect resources that are saved from preventing this to improve health and wellness?
Well, one thing, we've met with docs in Washington, D.C., and they did a thing. You know how you were told to stay in your lane? Docs were told to stay in their lane when they talked about gun violence prevention and what they see. So anything you can do around that, you know, talking about this is your lane, because you see everybody doesn't die. You know, a lot of people don't die, but you see the aftermath and how much that costs the person, you know, the victim and his family, and how much it costs society. So I think getting behind pieces of legislation, whether it's in the state or whether it's federally, when you can join us and speak out. I just did something with an emergency room doctor. He's from Indiana. I did a piece with him. And then Gwen Moore is Wisconsin, I'm Illinois. We just did a gun violence prevention piece, and we had a doc, we had a police chief, we had a young person, and we had a violence interrupter. And so we talked about community violence and police accountability all together. But anytime, doctors are so well respected, anytime any of you could be a part of a panel or endorse a bill, it's really important, because you not only see the people that die, you see the aftermath and the family and how it affects so much.
Absolutely, Congresswoman Kelly. We would at NextLevel see, you know, our admitted gunshot wounds, you know, coming out with multiple. If they lived, they're coming out with multiple, whether it be a wound or, you know, different tubes that they had to wear for a while and then, you know, get taken out, mental health issues. I mean,
Right.
it was huge, and so much of that's not addressed. And
Mm-hmm.
so it really ends up kind of creating like a cycle, right, of probably poverty, depression, and other things. So, hey, we just got, this is,
I'm
go ahead.
No, I was going to say, I'm glad you mentioned mental health, because that's so important. And we hear it over and over again I hear it from people that do police, community relations, and others, that we definitely need more mental health professionals, and especially mental health professionals of color, and more access to the professionals is such a problem. We have legislation that, yes, deals with trafficking and those kind of things, but also deals with police, community relations, but also investment in these communities. Again, I go back to opportunity, hope, job skills, access to healthcare, whether, mental health or physical.
So we got about 10 more minutes with you. We know you have a hard stop. Everybody knows that. So, hey, this is hot off the press. I hope you'll be okay kind of talking about this a little bit. It looks like the Supreme Court may be upholding the ACA. It was in court today.
Oh, no, I know.
I just got a note. The majority of the Supreme Court appeared ready Tuesday to uphold most of the Affordable Care Act in the face of a challenge from Republican-led states in the Trump administration. Two key members of the court, Chief Justice Roberts and Justice Kavanaugh, said that Congress's decision in 2017 to zero out the penalty for not buying health insurance did not indicate a desire to kill the entire law. Any thoughts about that?
I'm thrilled. Over 20 million people would have lost with kids under 20 pre-existing conditions, which people are going to have a lot of now because of COVID. We know the ACA wasn't perfect when it was passed. I wasn't there, but we know it wasn't perfect. And we know there's work to be done, but at least, we have a foundation to work off of and to improve. But, we had talked about even starting from, and we had to start from scratch if they made, we didn't think a decision would come back this quick or this information, but that we were ready to get to work, under President Biden in January, whatever we needed to do to alter what they did. So I'm thrilled.
Yeah, so that they've indicated, so I don't think they voted yet, but it's kind of good news that they're taking the temperature. Any insights on, just curious, I mean, some people might say this is like the year of the woman and whatnot. Any thoughts about having more women in Congress? I mean, I think a record number of women ran for office this year. They didn't all win, but some of them did. Any thoughts about how that affects the climate, the temperature? I mean, what have you learned over your years as you've seen this balance kind of shift a bit?
Well, I don't want the men listening to get mad at me, but even when I was a state rep, the women had a bipartisan women's group in Congress. There's a bipartisan women's group, and funny, we both do softball games. With the men, the Dems play the Republicans. With the women play together, and we play against the press. So you see it played out, you see it played out so often how the men are against each other. But I think that it really brings issues home, like the whole, the kitchen table issues, the women and the family issues. Not that men don't care, because they do. And also, we have women in intelligence, and, I was the ranking member, the head Democrat on IT and cybersecurity and that kind of thing. But I think that women do have this tendency to get along better, to put the egos, at the door. Not every female, but most. And, like I was saying, Amy Klobuchar said she already called, somebody on the Republican side, and a Republican woman already called one of the Dem women on the, in the House side. So, and we do have a caucus where it's bipartisan and bicameral, so that we try to work together on issues that affect women, children, families, and a lot of different things. And we need more, because we're still only like 1/4 of the House, and we're, a bigger part of that in the population. So it's very important we have more women.
Your thoughts about kind of you talked a little bit about COVID-19 in the context of kind of job training and creating opportunities, but it is probably the challenge of our lifetime. In the midst of a global pandemic, 1,000 people now are dying a day again in the United States. And that's with better therapies. Theoretically, we're thinking everyone has access to I don't know, remdesivir and the antiviral and steroids, which is kind of the part of the toolkit now. But 1,000 folks a day are still dying. And so we've come in up on, hundreds of thousands of cases a day. What's your thought about kind of us getting control, and any thoughts that Congress has around this, or you, what's your thinking here?
Well, first of all, I believe that we have to get some legislation passed. We have to send more money for testing, contact tracing, and treatment, and education and awareness. That is a must. We have to follow the science and the docs. We have to follow what you guys, are telling us. And then the other thing is we have to get money back to the states and the local governments. They are suffering, and some of them, like some of the smaller governments I have, if they don't get money, they're not getting, revenue, and they had to spend money they didn't know they were going to have to spend. And teachers, they all have people losing their lives. So we have to get money into the states and help small business. And then, the equipment, that's needed. We can't have governors fighting against each other for equipment. We have to have a national plan. And I do believe we need to have a national mandate that you have to wear a mask. I mean, that just seems, I don't like it either, but it just seems such a simple thing that people, like we tell people you have to wear a seatbelt, you have to wear a mask to protect each other. So yes, government can do some things, but people have to listen, listen to the scientists too. But we definitely need to get the tools in. I mean, that's just, the bottom line for the healthcare field and for states and local government. The other thing is clinical trials. We have to, get more people of color to step up and volunteer also.
So we have about 3 more minutes with you. So we really appreciate your time today. I'm just looking in the chat to see if there are other questions. One of the, and Doc, Congressman, I don't want to throw you off here, but
That's okay.
I know you've heard that 50% in Illinois, over 50% of the COVID-19 deaths are in nursing homes. Is that something that has come to you? It's 40% of the deaths in the United States. Do you have any thoughts about how we're going to protect, our grandparents and our seniors, or any of those who are living in the nursing homes? Any thoughts about that, or what are you hearing?
There's been conversation around, and it's, we haven't seen each other for a little bit. We've all been in our district, but I know there was conversation around, and I'm not going to say whatever the proper name is, but to actually have people that go into the nursing homes that have expertise in this area, and to make sure the nursing homes are up to snuff, for lack of a better term. But we need more people in that vein. I don't know if it's quality assurance people. I'm not sure of the name. I can't think of it now. But that was one thing that was talked about, that we need more. I don't know if it's inspectors or, what the term is, to make sure that nursing homes are, up to the standards, or doing all the things, not just about COVID, but, just in general, that there are those standards in place that are being followed, I should say. But yeah, it was very alarming. I lost my uncle to COVID. He wasn't in a nursing home, but he was, an older gentleman. But that's the thing that I've heard, conversation around, first and foremost, to actually get, professionals that'll make sure that the nursing home is up to standard and they're doing everything they should be in light of pandemics, or that
Right.
we need more of those type people.
Well, I know that, there was some federal aid supplied, but I think we want to be sure, as healthcare professionals, we want to make a recommendation that this be something that's prioritized, right? Because these folks, I mean, honestly, they're very vulnerable. That, that prevention, training,
Mhm.
access to PPE, just a lot of it, right? Like there shouldn't be a question. And then for the people who come in and out of the nursing homes, that they're properly trained as well and directed so that when they go home, they also protect their families and
Right.
protect themselves. And one of the teachings that we do with our staff here is that we tell them sometimes in your own home, you may need to wear a mask. If someone is, say,
Mhm.
working in a nursing home, maybe they need to wear a mask when they're home because just to be sure that it's not spreading as you come and go. So that's something that we'd like to, just if it comes to your attention as it comes, you probably have nursing homes in your district
Oh,
that we sure
definitely.
that they're getting proper PPE, proper training and support,
Mhm.
not sort of post-mortem, for lack of a
Right.
better word, but
No, we
thank you
need
so
to
much.
be
Yeah,
better prepared for, and there's legislation around that, to be better prepared to deal with COVID in the short term, but in the long term to be better prepared because there will be other pandemics and other issues.
unfortunately, that's the truth. So, Congresswoman, our time is up, but I think
Thank
we've
you.
had a very engaged 32 people on, and you've answered all of the questions. And we just want to thank you for your time, and hopefully you'll come back and see us again sometime next year.
Thank you so much. Everybody be safe and wear your mask, and good to see you. Take
Okay.
care.
Have a great day.
You
Bye-bye.
too. Bye.
Bye-bye.